If you want to know when is the right time for your dad to leave ICU and go home with intensive care at home, stay tuned. I have news for you. Hi, my name is Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies at home, and where we also provide tailor-made solutions for hospitals and intensive care units whilst providing quality care for long-term ventilated adults and children with tracheostomy at home, otherwise medically complex adults and children at home, which includes home BIPAP, home CPAP, also home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium infusions, home IV magnesium infusions, and home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management. We also provide palliative care services at home. We also have sent our critical care nurses into the home for emergency department bypass services. And we can do the same for your hospital as well. Okay, today I want to answer an email from Sue, who says, "Hi, Patrik, my dad has been in intensive care for 4 months now. He has a tracheostomy, but has been off the ventilator for about a couple of weeks now. He is on and off dialysis, and he's also on and off small doses of inotropes, such as noradrenaline. Can my dad go home with intensive care at home?" Well, Sue, thank you so much for asking that very succinct question. And I know we've spoken on the phone before. Look, your dad can definitely go home, even if he's on small doses of inotropes such as noradrenaline. Most of the time, if it's a small dose of noradrenaline that he needs, it could be changed to midodrine, which can be given via a PICC tube or a nasogastric tube, right? Your dad in this situation will most likely need a PICC tube. At the moment, he still has a nasogastric tube, so he will most likely need a PICC tube. But once he's got that, and the inotropes, the IV inotropes such as noradrenaline or norepinephrine are changed to midodrine via the PICC tube or the nasogastric tube, then he can go home. Dialysis can be done as an outpatient, right? If he needs it 3 times a week or whatever the case may be, he can go there as an outpatient with our nurses, of course, because your dad will need 24-hour nurses at home, intensive care nurses at home, to manage the tracheostomy, to manage the midodrine, to manage all the other medications he's got going on, to manage the safety of the tracheostomy in particular, but also to manage the PICC tube and also manage all other nursing care aspects that he needs, which is 24-hour nurses with intensive care nurses. Otherwise, he couldn't leave ICU. So this is all doable because we have clients at home that are on midodrine, for example, and midodrine is a vasopressor, right? And that needs very, very close monitoring of ICU nurses 24 hours a day, including monitoring of the tracheostomy, of course, making sure it's not blocked, making sure it stays patent, making sure the inner cannulas are changed regularly, making sure it's getting the nebulizers, getting the suctioning, and also that he's getting mobilized every day so that he can build up his strength. I hope that answers your question, Sue. With intensive care at home, we are currently operating all around Australia in all major capital cities, as well as in regional and rural areas. We are an NDIS accredited service provider. We are also a TAC approved service provider in Victoria, as well as WorkSafe in Victoria, iCare in New South Wales, and IISQ in Queensland. We are also a DVA approved service provider all around Australia. We have received funding through public hospitals, private health funds, as well as departments of health. We are also providing level 2 and level 3 NDIS support coordination, which would be critical in a situation like that to get on the NDIS funding scheme, right? And if you're at home already, maybe in a similar situation, and you don't have enough support, you don't have enough help, you have maybe support workers instead of intensive care nurses, which could quite literally be a death sentence, because we know that many clients in the community have died on ventilation with tracheostomy because they had support workers or even general registered nurses without ICU experience looking after them, and that can be a death sentence. Unfortunately, I am not exaggerating here. I also encourage you to look up our and the evidence-based mechanical home ventilation guidelines on our website at intensivecareathome.com. I will link towards them. The evidence for home care with ventilation and or tracheostomy is to have ICU nurses with a minimum of 2 years ICU experience, 24 hours a day. That is evidence-based. The evidence comes out of over 25 years of intensive care at home nursing in Germany, as well as evidence out of intensive care at home nursing in Australia since 2012. We are the only service in 2024 in Australia that has achieved third-party accreditation for intensive care at home nursing. There is no other service in Australia that has achieved that level of third-party accreditation, as well as built the intellectual property that we have built to deliver the service. Now, and don't worry about funding. You know, many families think they can't get the funding for intensive care nurses at home. Well, we wouldn't be in business if the funding wasn't there and if we didn't know how to advocate for it. That's also why we're providing level 2 and level 3 NDI support coordination now. And if you are an NDI support coordinator watching this and you're looking for nursing care for your participants, please reach out to us, especially when it comes to our specialty ventilation, tracheostomy at home, seizure management as well. I encourage you to reach out to us. If you need a specialist nursing assessment, we can also do that, a specialist nursing assessment, and we can help you with the advocacy. You know, if you don't know how to negotiate with the NDIs, if you don't know what documents to provide for someone medically complex as our clients, please reach out to us. We would want to help you. So with intensive care at home, also our mission is to keep our clients at home predictably so they don't go back to hospital all the time. And if you're at home already, once again, you're having issues, you can't find a provider that can create stable teams, let alone can help you with intensive care nurses, please reach out to us. And you can reach out to us at intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. And if you are a critical care nurse and you're looking for a career change, we are currently offering jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Victoria, as well as in Warragul in Victoria. If you have worked in critical care for a minimum of 2 years, i.e. ICU, pediatric ICU, ED, and you have ideally completed a postgraduate critical care qualification, we want to hear from you. We are offering a tailor-made solution to our clients, which includes regular staff. Our clients want to have the same staff coming over and over again because they are so vulnerable, and it's all about relationship building for us and for the clients. So only apply to us if you can give us regular availabilities. We are not a nursing agency where people come and go. It's all about building the relationships with our clients and our staff that are win-win situations. And if you're an intensive care specialist, we also want to hear from you. We are currently expanding our medical team. And if you are an intensive care specialist currently working in ICU, we can help you eliminate your bed blocks in ICU, especially for your long-term ICU patients, and we can help you there. And you won't even pay for it with all the funding schemes that are paying for community care. And if you're a hospital executive and you have bed blocks in your hospital, in ICU, in ED, respiratory wards, etc., we can help you as well. Please reach out to us. We have also sent our critical care nurses into the home for emergency department bypass services as part of the Western Sydney Local Area Health District, the In Touch service. And we've avoided many emergency department admissions in the past by changing PICC tubes at home or in residential aged care facilities, changing PICC tubes, changing nasogastric tubes, changing tracheostomy tubes, changing IDCs, SPCs, changing casts even, you know, and we've avoided emergency department admissions. You know, again, it's all about creating that win-win situation for everyone. And if you're in the US or in the UK and you're watching this, we want to hear from you as well. We can help you there privately. And once again, all of that you get at intensivecareathome.com. Call us on one of the numbers on the top of our website or email us to info@intensivecareathome.com. If you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, what questions and insights you have. I also do a weekly YouTube live where I answer your questions live on a show. and you will get notification for the YouTube Live if you're a subscriber to my YouTube channel, or if you're a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.